This is Ali Ajmal, your psychologist. Today we are going to talk about children issues. Yes, usually children are having different kind of issues which can be taken as clinical issues like autism, ADHD, Asperger syndromes, along with many other such kind of mental health issues. And yes, our children are usually having such kind of condition which are, by the way, non-clinical, which has nothing to do with their mental health, but these are reflecting some behavioral issues that our children are disobedient, they are not giving to your advice, they are not listening to you. So these are some behavioral and conduct issues in our children. It came to my experience through my clinical practice that many parents confuse the symptoms of their children. Many people come to me, parents, they ask me that if their kid is suffering from such kind of condition like autism, Asperger syndrome, etc., etc., just because of their disobedience, just because of their irregular sleep patterns. So here I would like to clear this misconception that every problem in children is not a clinical issue. Every problem in conduct or in behavior of our children are not reflecting some kind of big mental issues, as most of the parents are referring to some autism and such kind of issues. But it is good that we should take care of our children by looking their patterns. Yes, there are many kids who are suffering from autism and Asperger syndromes, and if we look into their patterns, we would be able to treat them at an early stage. But at the same time, if our kid is suffering from some behavioral issue, from some conduct issue, and we also need to work on it. Usually children are disobedient. Many parents complain that their children don't listen to them, they don't eat good, their sleeping pattern is disturbed, sleepwalking, sleep talking, bedwetting, and sometimes self-harm in children. Well, yes, our children nowadays are suffering from a diversity of mental health issues. Among them, depression, autism, Asperger syndrome, conduct issue, suicidal ideation are some common thing. And we need to treat these issues. Being parents, sometimes it came to my experience that our parents go to denial that no, our kid is not suffering from any kind of condition. Well, denial wouldn't take you anywhere. It's not good for your kid. If you see any kind of problem, any kind of behavioral anomaly in your kid, sometimes delayed language, delayed mental growth, if we look such kind of thing in your children, I would suggest that you go to psychologists and just get assess your children. There is no harm to consult with some psychologist. Most probably, maybe your kid is not suffering from some issue which need to be treated, but there is no harm to get consulted. So being parents, you need to look and you need to continuously look for your children's behavioral pattern, his emotional issues, and such kind of thing which is obvious through the eye of a non-expert, which everyone can observe. If you see any kind of behavioral problems or any kind of oddities in the nature of your child, you need to consult some psychologist. So at early stage, if you would do that, it would be much easier for the therapist to cure the condition of your kid. If you want to consult me for any of your kids issue, you can contact me through following given number. So you can be given appointment on my clinic, or I am also available for online consultation. Take care of your kids. Thank you very much.